and welcome back to ERNs on Air, the quarterly bonus series of the EURORDIS Rare on Air podcast. In our ERNs on Air series, we take a deep dive into the operations of the European reference networks. I am your host, Julian Poulin, and in this episode, my colleague Nora Lazaro will be talking to Emma Kinloch and Annalisa Trama from EURACAN, the European Reference Network for Rare Adult Solid Cancers, to talk about how patients can get involved in defining and developing rare disease registries.
Hello, everyone. I am Nora Lazaro, and today we'll discuss how the patient representatives from the EURACAN, the European Reference Network for Rare Adult Solid Cancers, contributed to set up and develop a registry for adult rare cancer. To talk about this subject, we have two very special guests who have been involved in this project since its beginning. We have, from one side, Emma Kinloch, patient representative in the EURACAN network. And we also have Dr. Annalisa Trama, epidemiologist in EURACAN and coordinator of the registry as well. Emma, Annalisa, welcome and thanks for joining us.
Thanks for inviting us.
Good morning. Thanks for asking me to join.
Good morning. Okay, so I think we are all set and we can get started. Maybe Emma, we can start from you. So you are a patient representative in the network for rare adult solid cancers. How did you get involved in the network? Maybe you can share with us your motivation.
Absolutely. Thank you. So I'm the founder of a small charity focused on some types of rare head and neck cancers, and they're called salivary gland cancers. For us to move forward with research into these cancers and to get better treatment options and outcomes for all of the patients affected by these cancers, we need collaboration. There aren't very many of us, as I'm sure that many of the listeners are aware, when there are only 5 per million per year in the UK, so very small numbers. I was very actively involved in patient advocacy in the UK for salivary gland cancers and other rare cancers, and I wanted to connect with others from different countries for this collaboration, and also to share best practice, support each other, and work together.
Thank you so much, Emma, for sharing your experience. And in your own words, what a registry is? How would you explain the EURACAN one and why was this registry needed in your point of view?
So in this context, I would describe a registry as a place or a system which contains data or information about a group of people. The EURACAN Starter Registry is collecting data from hospitals about rare head and neck cancers, the patients, the diseases, the treatments they've had, and their outcomes. It's so important because, as I've mentioned, there are very few numbers of patients. And that makes research into these cancers and other rare cancers very challenging. It's difficult to prove things statistically. It's difficult to get enough people into trials. It's very hard to prove things. They're also really poorly understood. They have very poor prognoses. Patients don't necessarily do very well. And we desperately need to move forward with our understanding and with research into these cancers. So what the registry will do is, by collecting data for as many of us as possible, we'll have it all in one place. And we've made sure within the infrastructure that we're making that data available to researchers. And by doing that, we're taking a massive step forwards.
Thank you so much, Emma, for highlighting the importance of the registry and explaining the EURACAN one. Annalisa, you have worked towards the involvement of EURACAN patient advocates in the development of the registry since its beginning. How did you ensure the participation of patient representatives?
Thank you, Nora, for the question. It was easy because EURORDIS, and I have to thank especially Ariane Weyman, did an amazing job because they developed for each of the European reference network and therefore also for EURACAN patient advocacy groups. Now, I have to explain that EURACAN, you mentioned, is a European reference network for rare adult solid cancers, which basically means that within EURACAN, 10 different families of rare cancers are included. And EURORDIS has identified patient advocates for each of these families. So the ePAGs for EURACAN are made up of 10 and even more than 10 patient advocates. I basically contacted the ePAGs of EURACAN since I'm the coordinator of the registry, as you recall, but I'm also part of the steering committee. So I asked the ePAGs to be involved, and I established a working group with them dedicated to the registry. That's how I managed to involve them since the beginning. And we used to have a monthly meeting in which I was providing updates about the registry, and we were discussing issues, problems, and documents to be revised or developed.
Thank you, Annalisa, and thank you for pointing out that actually it was easy, right? Like to involve the patient representatives in the setup of the registry. Could you maybe explain to us why patient involvement was important in the set of the registry?
With pleasure. Yes, I said it was easy. It was easy thanks to Ariane, but it was easy also thanks to all the patient advocates, because they are really super committed and super experienced. And this was really, what I realized working with them. So, when you establish a registry, the first things you have to do is to define the objective of the registry. We tend to define this objective based on the expert knowledge, the clinical knowledge. But the EURACAN registry decided to involve and to ask also to patients about what they felt had to be the objective of the registry. Because, of course, they know the disease. Sometimes, in the same way as a clinician do. So they were really instrumental in developing the objective of the registry. And I think it was really important to discuss with them the ethics behind the data sharing, the provision of data, the exchange of data. You might know that now with the new data protection regulation, there are some concern about the privacy. And of course, we wanted to be very transparent and ensure to protect the privacy of all the patients registered in the registry. So it was with the help of the patient that we decided to be very innovative and to choose for a so-called privacy-preserving solutions. So the registry is federated, is using artificial intelligence for analyzing the data exactly with the intent to preserve the privacy, which of course was something discussed with patients. To be honest, I think that the most relevant contribution that patients were key in was the development of the governance of the registry. The governance is a document that is important because it clarifies who can access the data and how the data can be accessible, also for researchers that were not involved in registering the data. Well, thanks to the patient, because they were very, very vocal, on this point. We actually have a vision for a registry that is really open. So it's really fair. It can be really accessible to any stakeholders that in any how can contribute to improve researchers on research on rare cancers. And I think this was really thanks to the patient that we managed to be so open.
Thank you, Annalisa, for this clear overview. Emma, together with the rest of the EURACAN patient representatives, you were not only involved in the setup of the registry, as Annalisa just mentioned, but also you will contribute to the governance of the registry when it's fully functioning, ensuring patients are part of the decision-making. What will it mean for a patient representative like you to be part of the registry steering committee?
Thank you for the question. So to answer it, I think it's important to stress how involved we've been all the way through. And as Annalisa said, there were many of us involved, and we were very, very vocal about what we felt and what we wanted. There are many areas of cancer research where the patient voice is asked or sought, but it's done in a consultancy way. We're asked to, what do we think? And then it's taken away and put into a committee. That wasn't the case here. We were fully integrated into the registry project from the very beginning to the very end. Unlike many examples from many of our lives where we've just been asked our opinion in a separate room almost. And here, absolutely, we're involved in the steering committee, we're involved in the governance, we're involved in the governance of the trials, the projects, and the databases. So from the very beginning, as I said, from the initial strategy all the way through to the ongoing governance, we've made decisions around how the data would be collected and stored, the materials that would be provided for patient consent, the data points to be collected. And that's really important. It's very important for the patient perspective on what are the important data points to be fully integrated in such registries and databases and trials. And, patient-reported outcomes and real-world evidence are increasingly seen as important things, and they are. So back to your original question, sitting on the steering committee on an ongoing basis, we will evaluate proposals for research, and we can say if we don't like them or if we would like an improvement in some area. This ensures that the patient voice and the patient perspective is always integrated into any research that is facilitated by the registry, and that it is always a benefit for patients. We're very much part of the registry. We feel part of it, we've been part of it, and we will continue to be part of it. We haven't just been asked, what do we think?
That's great to hear, Emma. And I believe that also having patient representatives involved since the beginning, it also creates a culture of patient-clinician partnership since the beginning, since the roots of the project. And I think that's very valuable. Annalisa, a question for you about the future. What are the expected outcomes and benefit of the registry for the patients?
Well, what we hope is that the registry will really provide information that could help to better understand the natural history of rare cancers, to identify prognostic and predictive factors. And why this is important for patients? Because this information are essential for doctors to take decisions. And of course, to take the right decision is difficult when we deal with rare cancers. So increasing the information available for clinicians through the registry, we hope that we will support better clinical decision-making. And we really hope also that we can ameliorate in this way the quality of care for patients. The registry is an infrastructure, and as such, it can be used also, for example, for research. Not, of course, for clinical trials directly, but of course, we are discussing also with the European Medicine Agency about how the registry can serve as external control, for example, also for clinical trials. So the registry in the future could be used also for research, and we know that the research is essential also to identify new treatment and therefore again to improve quality of care for patients with rare cancer.
Thank you, Annalisa. So we are finalizing this podcast with a question for you both. Maybe Emma can start. Any advice for other networks that might be starting the registry?
Yes, I think from an ePAG or patient advocate perspective, it can seem a bit daunting to be involved in a project like this, because there could be aspects of developing a registry that are very technical, and people may feel that they don't have the relevant expertise. But I would say, do not be put off by that. There will be many people willing to support you, sharing knowledge, experience, and best practice. And that, of course, includes other ePAGs or patient representatives that have been through the process. So don't hesitate to reach out if you're thinking of it and want to have a chat. I really would say go for it. And I really would say that the whole experience has been incredibly positive. And at the end of the day, we all want the same thing. As we touched on earlier, The only way we can move forward for rare cancers, rare diseases, is by collaborating and working in partnership between patients, clinicians, researchers, etc., etc. We all need to work together, and that's why EURACAN and the European reference networks are there. It's fostering these collaborations. The potential for moving things forward and bettering outcomes for patients by using these registries is so important that the opportunity should not be missed for fear of, needing a bit of training or not having experienced it before. Go for it.
That's a great motivation statement. Thank you, Emma. And I think also you made a great point about sharing experiences. Like if fellow patient representatives are maybe in the same boat, reach to each other, and you can share practices as well, which is always good. Same for clinicians. Annalisa, and from your side, any advice for other networks that might be starting their registries?
Sure. I have to say that the registry, to develop a registry, it's a complex task. But if you succeed, you will end up with having a gold mine. So I really think, as Emma said, we should go for it with some advice. First of all, we discuss a lot patient engagement today. But for developing a registry, we need a wider and heterogeneous range of expertise. So for those that are thinking to initiate a registry, I would recommend to really be equipped with different type of expertise, because we need, of course, patient, but we need also clinical expert, we need technical expert and legal expert. You have to be prepared to spend a lot of time on it. A registry, I tend to say that is forever. Just to stress that it's not a project that starts, today and will end in 2 or 4 years as we are used to. It's really a long-term vision, an infrastructure with a long-term vision. That's why you need to be always very active and believe that this is the right way to go ahead. I have to admit that especially in this regard, ePAGs has been really, instrumental for pushing the registry to continue. So not only to start, but to continue. And now we are actually discussing how we can scale up the registry to all the family of rare cancers. So this would be my recommendation. And of course, I still thanks, all the EURACAN ePAGs, because I think it's really thanks to them if EURACAN has a registry today.
Thank you, Annalisa, and thank you, Emma, also for being here with us today. It's been lovely to have you. So I think that's all for today's episode. I want to thank you once again, Annalisa and Emma, for sharing your experience with us. I think it's very valuable also for our audience to hear from your perspective. So thank you so much.
Thank you.
Thank you to you.
Thank you for listening to this episode of ERNs on Air from the quarterly bonus series of the EURORDIS Rare on Air podcast. We look forward to you listening to our next episode.